here, move here, here. So let's just look at diseases in the eyes of public health. Diseases in the eyes of public health. So a disease is basically an abnormal condition or a disorder that affects the function of an organism. Okay, so basically, when you have certain signs and symptoms and there are pathological changes, whether in the tissues or cells, or basically in the body, say that you have a disease. Usually, using the biomedical model that we looked at, when you have a disease, we go and test. If we see it, then we treat it. But you can also have another similar or related word called illness. Illness is a subjective term. Okay, illness is a subjective term of not really feeling that way. It's basically suffering, and suffering may not mean that there is actually diagnosis. So you may be suffering without a diagnosis. So disease is much more of a medical term, whereas illness is it's a subjective thing where you don't have a medical diagnosis. You may not have a medical diagnosis. Diseases can be caused by a number of factors, microbial factors or genetic factors, or even environmental factors. Some of the diseases happen because of interaction of environmental factors and genetic factors and even infections. So you can have a disease that has a combination of those factors. Diseases can be classified in many ways, whether it is according to what causes them, that is etiology, what organ system is being affected, or the mechanism through which the disease process happens, that is pathophysiological classification, or according to the clinical signs and symptoms, whether it is acute or chronic or subacute. Can also be classified to according to the extent of severity, the age of onset, inherited or acquired, communicable or non-communicable, a number of really different classifications. So you move to the theories of disease causation. The theories are very important because they allow us to design the right public health interventions. So the humoral theory, this was in the ancient times, if you remember that history of public health, where ancient physicians believed, or ancient physician called Hippocrates believed that diseases were caused by imbalance in fluids, what we call humans, okay, and that the treatment for diseases therefore was to make sure that you restore that balance in fluids, and issues like bloodletting or purging become were the main interventions by then. And then the miasma theory, which I talked about earlier on, which was that people get diseases by bad air. Bad air is one causes these diseases. Of course, there is an element that this bad air comes from the filthy organic matter. And then therefore, there's a connection between diseases and the environment or sanitation. And the interventions then were basically to make sure that the urban authorities make sure that there is proper sanitation. And then, as time went on, of course, the germ theory came in now. This is where Robert Koch and Louis Pasteur played an important role in indicating the role of microorganisms in causing diseases. And then, of course, in the 20th century, not very long ago, emphasis was placed on what we call chronic diseases or non-communicable diseases. Investigation of heart disease and lung cancer were really ongoing. That is when there was recognition that life factors such as smoking, diet, physical activity contributed to disease. Okay, and that is where the origin of health promotion and disease prevention uh, were emphasized. In this generation, we think about diseases being caused by what we call social determinants of health. So we have what we call the social determinants of health model or framework. So if you're going to look at what causes diseases in public health sense, we say that the diseases are caused by factors that are related to where you stay, where you go to school, where you work, related to your family, related to the environment you're in, related to all other factors. If you remember the ecological model, okay? The ecological model emphasizes the levels of influence, but basically the factors in there are basically almost the same. Uh, the factors that are individual, the factors that are interpersonal, the factors that are because of the community and the society and things like that. So the social determinants of health basically emphasizes that you see where you live, where you stay, where you work, your family network, your community network influence your health. Okay? And then the ecological model is basically what I've just explained. And then now also we have a lot of emphasis on that. After realizing that diseases like cancer, hypertension, diabetes can be influenced by lifestyle. It means that if we make people to change their lifestyle, to adopt their health behaviors, then we can be able to achieve better health outcomes. Okay, so the emphasis now is on health promotion and prevention with the good recognition of the role of behavior change theories. Okay, theories such as the health belief model theory of planned behavior, social cognitive theory become very important in designing health intervention. So, for example, if you want to make people exercise, what theory are you going to use? When they exercise, what happens? And things like that. So we can really prevent diseases through different levels. Often you will see textbooks talking about primary prevention, secondary, and tertiary. In this presentation, I focus on 5. Primordial prevention, primary prevention, secondary prevention, tertiary prevention, and the quaternary prevention. So let's look at each of these and what they actually mean. Primordial prevention is basically related to the other pyramid, health impact pyramid. If you remember that, the lowest level has the highest impact or the greatest impact. So with the primordial prevention, what we are basically doing is to make sure that there is no emergence of risk factors. Risk factors are the ones that increase the chances of you getting a particular disease, but we don't want these factors to be there. So if you make sure that these factors are not there, then you're preventing diseases. So that is primordial prevention. So the examples of interventions at this level is promoting healthier lifestyles, making sure that poor people are not really poor, or reducing what we call social inequalities and creating an environment that discourages harmful behaviors. Okay? People have not yet adopted these harmful behaviors, but you create an environment which does not really promote these harmful behaviors. And then you move to primary prevention. These are interventions that are aimed at preventing diseases from occurring. Immunization is an important example. Health education, breastfeeding, these are primary interventions. Secondary interventions, this is when the disease has not really manifested, but you want to detect the disease early enough, and that is what we call screening. So screening for hypertension, screening for cancer, those are secondary prevention interventions. And then we move to the tertiary ones. This is when the person has the disease. The person hypertension. Your emphasis now is to make sure that the hypertension does not cause stroke or what we call disability. Okay, so rehabilitation and other interventions fall under that. And then we have what we call quaternary prevention. This one is concerned with taking action to mitigate or prevent harm resulting from medical interventions or excessive health care. Okay, we have people who have diseases that are complicated to manage. Okay, and sometimes may not be actually complicated, but you find out that the people are actually being given a lot of medications, over diagnosis, over treatment, unnecessary medical procedures. Okay, if you put if you have interventions to prevent people from being overgiven medications or undergoing unnecessary medical procedures, then that is quaternary prevention. Okay, if you receive a lot of medical care, it's not really good. It's not good. You only need to receive medical interventions that are beneficial. Don't oversee medical care for unnecessary reasons. If you aim at that, that is quaternary prevention. When we talk about burden of disease, we refer to the extent to which given diseases and conditions are affecting the population. We want to know what diseases are affecting given populations and to what extent. For us to know that, we look at three major dimensions or indicators. Okay? Or basically, when we talk about burden of disease, we refer to what we call health indicators. Health indicators tell us the health status of a population. And when we talk about health indicators, we talk about mortality indicators, morbidity indicators, and then we also talk about life expectancy, and then also disability adjusted life years. If we know this data, we can really plan for the population and make sure that they have the right or services to prevent, control, and even treat diseases and manage health problems. Okay, so when these parameters, let us start with what we call morbidity. Morbidity basically refers to illness or reporting of disease. If a patient comes and then you check for malaria and then they are positive, that is a case of malaria. So it's a report of a given disease, the patient having a particular disease. That is morbidity. So for us to know to what extent people have diseases in a particular locality, we look at two indicators. That is prevalence and incidence. Prevalence, number of people who have a given disease in a given population, where we calculate it by getting a number of people who have a disease over the total population. So it can be in terms of percentage, it can be in terms of basically numbers, okay? So that is prevalence. Then incidence, this is where if a person comes and then we have them tested for a given disease over a given in a given time. Okay, so for example, we can say that from Monday to Friday we have got 5 new cases of malaria. So that becomes the incidence. Okay, so it is the number of new people with a given disease over the total number of people at risk of a specified period of time, which in my example is 1 week. When we talk about mortality, we refer to the number of deaths, and basically mortality rate is the number of deaths because of a given disease over the total number of people. So mortality rate can be calculated by that formula. And then the other indicator, which is basically life expectancy, which basically indicates the average life expected the average expected lifespan based on current mortality rates. Okay, given the mortality rates of South Sudan, if a child is born today, how long will they stay? That is basically life expectancy. Life expectancy definitely shows us that the health outcome or the health status of a given population. If the health status is actually good, then it's most likely going to have a longer life expectancy. So life expectancy is very good for planning purposes and also for planning for people who are aging. Diseases don't happen from the blue. There should be those factors or conditions or characteristics that really increase the likelihood that you get a disease. These factors are what we can call risk factors. Okay? And this takes us back to the concept of determinants of health. Okay? Determinants of health. That we have found some factors that make us have an increased chance of getting particular diseases. These factors can be modifiable or non-modifiable. Non-modifiable, of course, they can't change. Your age, your gender, ethnicity, you cannot. Okay, but your behaviors, they are modifiable. Okay. Generally, if you talk about the major health problems that we face, of course, in South Sudan, we talk about communicable diseases. They have a huge burden that they place on the health system. But of course, on top of these communicable diseases, we have problems to do with maternal mortality, child mortality, malnutrition, even access to water and sanitation are still very huge challenges that we really face. So if we talk about burden of disease in South Sudan, of course, if I ask you this question, I expect you to tell me numbers. I want numbers. I want numbers, and I repeat that. I want numbers in terms of mortality, numbers in terms of morbidity, okay, numbers in terms of life expectancy, okay. But basically here I illustrate to you that we still have a number of big problems in terms of communicable diseases, in terms of even having outbreaks of cholera, measles, and sometimes we have suspected hemorrhagic fever, and we have some conditions which you can categorize as the what do we call them? The neglected tropical diseases such as Kalazar. So we still have a lot of problems. But on top of these real direct health problems, we still have problems to do with conflicts, people living in camps, people not having good access to proper sanitation and access to healthcare services. So these diseases happen because of the factors that we really talked about. Factors of where we live, where we stay, impact on our life. But basically also, when you look at the other factors of to do with policy, with politics, all these things that will also affect our life or the occurrence of health. So basically, we had looked at some of those aspects of the social determinants of health and the categorization where we can put them either biological, so behavioral, environmental, social. All these, you should be able to explain how they really cause diseases. For example, diet. If you eat a diet full with a lot of salt, for example, hypertension is likely to happen. If you exercise, then you're going to reduce the chances of getting some of these diseases. If you abuse drugs, okay, so you should be able to know or to relate all these factors and how they cause diseases. And we have a terminology called upstream and downstream determinants of health. This is to say that you see factors that influence your health can happen at individual level, okay? And we also have factors that can influence your health at social, economic, and even environmental level, okay? If you're going to, if if you're going to design public health interventions, you may need to look at which factors are you going to really focus on. It is better to look at both upstream and downstream factors in order to improve health. Improving health is actually very difficult if you're not um, deliberate on ensuring that everyone actually has equal access to healthcare services. But in reality, you can have people who are having poor health outcomes because of decisions that are unjust or that are avoidable. Okay, so if you have difference in health outcomes because of unjust policies or what you call avoidable issues, then we have what you call health inequity. Okay, if you have people having poor health outcomes because of decisions or because of policies that are unjust or because of interventions that are unjust, then you have what you call health inequity. So to achieve health equity, you need to make sure that everyone has an equal chance to access quality healthcare services. And that is when you have everyone having optimal health outcomes. So we move to the concept of inequality, which relates to the difference that may or may not be avoidable. Okay, so you can have health outcomes of populations that are not the same. Okay, they are not the same. Maybe population A has better health outcomes compared to population B, but that difference is not necessarily because of unavoidable reasons or unjust reasons. May not really be that. Okay, so this here illustrates further what health determinants are, whether socio-economic characteristic, whether health behaviors, whether medical factors. Basically, the thinking here is that all these factors have a way in which they influence health. Now, the emphasis about social determinants of health came about when a commission on social determinants of health was set up by WHO. And this commission was headed by Sir Michael Marmot. And this commission published a report which he basically called the Commission on Social Determinants of Health in the year 2008. Okay, now this commission established important or emphasized important things. One, we need to make sure that we identify people who are not having or who are having limited access to quality healthcare services. So an element of health inequity was highlighted. Of course, we have talked about social determinants of health, and then making sure that the policies that we really enact make sure that everyone actually everyone is at the same level, not creating what we call gaps. Okay, not leaving anyone behind. So policies should make sure that people's social and economic well-being actually improve, and that we can look at social determinants of health in or with the global health perspective. Okay, now we need to start comparing health outcomes or health indicators across countries, and this, if we do this, it enables us to identify where the gaps and work together in partnership and collaborations to be able to improve health outcomes. And then we have what you call the iceberg model, which is basically that you see the people who come to the health facility, they are just kind of few compared to those who actually remain in the communities and they are not aware that they have the disease. But by the time the person comes to the health facility, the disease does not happen from the blue. There are factors underneath that make the person to have that disease or come with that state of health. So that is basically the health iceberg model. Tells us that the people that you see in the health facility are just a few of those who may have the same condition in the community. But also, the person who comes with that condition has other factors that have made them to come with that state of health or that diagnosis of having disease by a particular condition. So what you see is just little. It's just the tip of an iceberg. The biggest part is underneath. And underneath are those factors that cause that person to come with the disease. But the part that you see and the part that is underneath, they work, you have what we call the intermediate factors. But by the time the person comes to the health facility, there are some factors that may or may not make them come to the health facility. And they are what we call the intermediate factors. So they relate to access to health services, health care utilization, and quality of healthcare services being offered. And then, of course, the health outcomes, which are basically at the end of the iceberg. Okay? So our emphasis in public health is to ensure that everyone has equal access to attain the highest level of health. And we achieve this by eliminating what we call health disparities. The health outcomes, we really eliminate the difference in health outcomes that happen across different populations. Okay, so if whether you're poor, whether you're rich, you should have similar health outcomes across the different populations or across the social economic classes. And then, of course, you need to ensure health equity, which is that you need to make sure that all individuals have an equal opportunity to achieve their highest level of health, regardless of their race, their economic status, their location, if any state or even race. Social justice is also related to the fact that we need to make sure that we have a fair and equitable distribution of resources such that people living in a given society have the same chance of being healthy like others. So to achieve this, we need to make sure that there is access to quality health care, there is education, employment, legal protection, regardless of where someone comes from, regardless of their socioeconomic class, regardless of anything. We want to make sure that people have the same privileges, same opportunities, same access to resources. Okay? That is fair and equitable distribution of resources, opportunities, and privileges within the society. It's not about individuals having that. It's about the society as a whole. When you do that, you eliminate what we call inequalities, okay, and discrimination, and therefore you achieve better health outcomes. So, how do you address the issues of social injustice? Of course, eliminate the structural barriers, eliminate the factors that make people not to access quality health care. Okay, have open and honest discussions around issues of being disadvantaged, promote empowerment, and then assist communities in expressing their requirements and concerns, safeguard the rights of all individuals. Okay, we have the concept of social gradient, which is basically to say that you see, if you are born in a poor family, it is very possible that you will have poor health outcomes. Okay, so that means that people of higher income status or higher income levels have better health outcomes compared to those who are poor. So that is what a concept of social gradient. So these social determinants of health can be measured. It is if you can measure them, then that means that you can be able to address them. You cannot address something that you don't measure. So assessment is very important. So how do you measure these determinants of health? You can measure them using what you call indices, indices that can be either be relative or absolute. When you talk about absolute indices, It means that you have a cutoff point where you say that if you spend less than this amount of money in a week or in a day, you are either poor, or if you spend more, then you're rich. Okay? So you can do an assessment and understand how many people are living below the poverty line and how many people are what you can call higher income uh, uh, class. Okay? Or you can use what you call relative indices. With this, you compare the income levels to the distribution of income in a given population. So you can have someone who is rich in this population but may be poor in another population. So you need to have, you basically compare the income levels to the distribution in a given population. So measuring social determinants of health is very important, and you can use different indices. In this example, I've just provided an example of how you can measure poverty as one of the social determinants of health. What we call the causal pathway in social determinants of health is that you see the different factors: your diet, your lifestyle, that is exercising, smoking, drinking alcohol. All these factors interact in a very complex way that will eventually lead you to have a disease. Okay, if for example, uh, if you for example you get lung cancer, that lung cancer could have been because of multiple factors, not only smoking. It could have been because of genetic predisposition. It could have been because of smoking. It could have been because of exposure to toxins. It could have been anything. Okay, so the mechanisms or the pathways through which all these factors interact to produce the disease of outcome is what we call the causal pathways. So we have some factors which are modifiers, which can modify the exposure and the health outcome, and then we have those which we can call intermediate factors that are between the exposure and the health outcome of interest. So we have those that can modify the relationship modifiers, and then we have the intermediate factors. So that is basically the causal pathway. That's what it means. And then this also emphasizes the fact that if with the goal of public health is to make sure that we have reduced health disparities. What can you do? You can, of course, implement interventions that address factors that affect almost everyone. Those ones are the ones we call the universal interventions. And then targeted interventions are where you choose a specific subpopulation that is affected by a health problem and then address that problem. So that is what you call it, a targeted intervention. So if you're going to improve or address health disparities, the focus should be on universal interventions, the entire population. But also, if you have enough data to know who is being affected by what condition, in order to bring them to have the same chances of obtaining the highest possible level of health, then you can also still have targeted interventions. So targeted interventions mean that you really put your resources to where there is great need. You don't misuse resources. Where you get greater utility, greater benefit is where you put the resources. But of course, if you aim at ensuring that there is equity, you may go with what you call universal interventions. We can also make sure that we look at health as a human rights issue. So using the human rights perspective, we can hold people accountable for not and making sure that all people have equal access to healthcare and having the highest level of attainable health possible. Okay? Using this perspective, we are basically saying that regardless of my economic status, regardless of how many we are, regardless of anything, I still have the same rights like any other person. So if we ask in public health, if we use the human rights perspective, we are making sure that even people who are underserved, marginalized populations can still get the same level of health that they actually need. Of course, there are people who are left at the bottom. They're having poor health outcomes. So we can term them as priority populations or people who are at a greater risk. Or basically, we can say they are vulnerable populations. These are these populations can be vulnerable because of low income levels, because they don't have the resources that they need, and things like that. So often these people can be stigmatized, or basically they are left at the peripheral of decision making, and they don't have access to resources, opportunities, and things like that. Sometimes they are socially excluded, so it is very important really to address issues that affect these populations. Okay, so I think enough is enough.